Hi Medical Squad, my name is Jacqueline and welcome to my channel Medicalology. Today I'll be discussing heart sounds and how to differentiate between S3 and S4 sound. As you guys know, I have the best mnemonic to help you pick out the differences between S3 and S4. So let's get started. I want to start off with the fundamentals. We need to understand what is the difference between systole and diastole. Systole means that the heart is actively contracting, and diastole means that the heart is relaxing, okay? Another way that we can think about it is systole equals ejection, and diastole equals filling the heart with blood. So, also, S1 and S2, that is normal. So when you go to your doctor's office and they place the stethoscope over your heart, the doctor is trying to listen to the S1 and S2 sound, which is the lub dub, lub dub, lub dub. That is normal. What is vital for us to understand is the EF. EF stands for ejection fraction. It should be between 50 and 70%. So if your ejection fraction is 45%, you should know that that is what? Abnormal. So guys, you need to understand and learn how to interpret this data because they can give you an ejection fraction in the stem, and you need to understand how to pull that out to know if this is abnormal or normal. Okay, so what is an ejection fraction? Ejection fraction is a measurement of percentage of blood leaving the heart each time it squeezes, right? Squeezing, ejecting, contraction. The ejection fraction is usually measured only in the left ventricle. The left ventricle is the heart's main pumping chamber. So, what can cause a reduced ejection fraction? Weakness of the heart muscle, such as cardiomyopathy, heart attack that damage the heart muscle, heart valve problems such as mitral stenosis, long-term uncontrolled high blood pressure. So we have and understand what the EF is. Also, let's start with S3. S3 equals eccentric hypertrophy added in series, and it's a reduced ejection fraction. I want to highlight this key point. S3 can be normal in children, young adults, athletes, and pregnant. So let me give you guys a hint. If they have a patient coming in, a 25-year-old female, she's pregnant, and they're telling you that she has an S3 sound, and they're asking you, is this patient's heart eccentric hypertrophy, concentric hypertrophy, a normal heart, a reduced ejection fraction? What do you think the answer is going to be? It's going to be normal. So guys, you can get tricked up, but you need to understand whenever you see an S3 sound, don't make it be your knee-jerk reaction to say this is abnormal. It can be normal in what? Children, young adults, athletes, and pregnancy, okay? Make sure you keep that in mind. So let's start with S3. How do we remember that S3 equals eccentric hypertrophy? So let's write S3. How do you remember that it's eccentric? I want you guys to flip the 3. The 3, what is that? E, right? So we understand that E equals eccentric hypertrophy. So let's put C-E-N-T-R-I-C. Guys, do not mind my handwriting. Also, how do we remember that it's added in series? So what I always do, I put a C plus C, because there's a C right there, plus C, and keep it going. Guys, you have to utilize all your resources because on step, you have a board, a whiteboard, you have a marker. Also, in my medical school exam, I had a board and a marker. So whenever I had a chance to pull out any mnemonics, I would write it down. So make sure you use the mnemonic. If you don't remember to put the 3, just put a flip, and you understand that that is an E. So you keep on writing C's, C's, right? And what is that doing to the eccentric? It's elongated it, right? So the C's are making it longer. So that is why there is a dilated cardiomyopathy with an S3 sound. Do you guys see that? Next, we need to understand that the S3 equals a reduced ejection fraction, right? Reduce. So we have to understand the pathophys. So let me get this out of your way, guys. Let me get it out of your way. We have to start off with the basics, right? So let's go in and write in our box. This is our left atrium, and this is our left ventricle, right? Remember, we also said that we are adding the C's to the left ventricle. There's your C, right? Keep on writing your C's. And what is that doing? It's elongating what the left ventricle and the left atrium. It's elongating the entire heart. That is why there is a dilated cardiomyopathy. And guess what? We need to understand that it's a reduce. So say, for instance, this is the black box. It's contracting, it's doing what it's supposed to do. Now I'm dilating it, right? I'm dilating, I'm trying to contract. Is this the same speed as this? No. So that is why there is a systolic dysfunction, because when it's dilated, it's trying to contract. It's not going to be the same ability as this one. That is why there is a systolic dysfunction. Because again, what does systolic mean? Contraction, right? So there is a systolic dysfunction in a dilated cardiomyopathy. Also, we can also think about a volume overload state. Why? Because if you look at this left ventricle, right, this is normal. The black box is normal, and you dilate the heart. What is that going to do for the in the left ventricle chamber? It's going to allow more blood to sit in this ventricle, right? Because it's so big, it can hold more blood. That's why you can think about a volume overload state. And let's think about pregnancy. You're carrying another child. You are having an increase in preload when you have a child inside of your stomach because you're caring for two people. So you can think about what else? Congestive heart failure. There's another example about Chagas disease. You can look at that in your first aid book. Also, alcoholics have dilated cardiomyopathy because they have a volume overload state. So always reference your first aid book. Okay, so we have S3 sound. Now let's go to S4. Let me get rid of this for you guys. And we are going to understand why is S4 equals concentric hypertrophy added in parallel, and there is a preserved ejection fraction. And guys, with this, I had a hard time wrapping my head around this when I was in medical school and also studying for step 1, because why is something preserved if the heart is affected? That's how I always thought about it. But you need to understand the pathophys to get these questions right, guys. And that's why Med Squad is here to teach you guys how to understand and digest the material. So let's go to S4, right? S4. What are we going to write in? S4. Let's use a different color. I'm not really feeling the green. S4, right? How are you going to remember that is a concentric hypertrophy added in parallel and there's a preserved ejection fraction? So I don't want you guys to write your 4 this way. Cross that out. So if we flip it, right, just like how we did with S3, I want you to flip it. And what does that look like? A P, right? So it's parallel and preserved ejection fraction. So we know that S4, we flipped the 4 to a P and it's parallel ejection fraction. So now we need to understand why is it concentric hypertrophy and also a preserved ejection fraction. So let me get this out of your way. So let's go back to our box, right? Our box, we're going to write in our left atrium and our left ventricle. What we said is that it is added in parallel. So parallel is this way, right? Parallel is this way. So this is making what? The left ventricle smaller, right? The left ventricle is smaller. So when blood is coming through, there's not going to be enough room in the left ventricle because the left ventricle is thicker. Concentric hypertrophy means that the ventricle is stiffened. So say, for instance, this is my ventricle, right? This is the regular size, and I'm trying to relax, right? It's relaxing. It's relaxing fairly easily, right? So now I'm adding more fibers, and now I'm trying to relax, and it's taking longer for all of the fibers to relax at the same time. So this 1 second, right? And now look at all my fingers. It has to stretch out. So what is relaxation, guys? Relaxation is diastole. There is a problem with diastole, which is relaxation. There's nothing wrong with the contraction force in an S4 dysfunction. An S4 sound, there is no problem with systole, only diastole, okay? That's why an S4 sound leads to a diastolic dysfunction because the relaxation part is affected and not, listen guys, and not the systolic. Only the relaxation part is messed up. So that's why diastole equals relaxation. And when there's more fibers, right? There's more fibers here. And it's harder for the ventricle to relax because it's stiffened. So that's how I remember that an S4 sound is related to a stiffened ventricle, right? And it also causes an increase in pressure. Why? Because if you look at anything, I always think about concentric as in stenosis. Like that's how I think about it. But just think about that something is constricted. Like it doesn't have the same rule. So if something is constricted on this side, on the left atrium, right, there's going to be more pressure building up right here. That is why for S4, it's considered as a hypertrophic cardiomyopathy. There's a stiffened ventricle and increased pressure. Guys, hopefully this was helpful and I clarified the S3 and S4 sound, and hopefully you can use the mnemonics to get these free points on test day. I'm going to do a cleaner version on the next point, on the next slide, and give you guys recall questions to see if you remember what is the difference between S3 and S4 sounds. Hi Medical Squad, welcome to part 2 of this series. The purpose of this video is to go over recall questions from the previous video, learning about the differences between S3 and S4 sounds. I have 3 questions on the screen, we'll go over them, but I'll give the explanation at the end. Each question, I'll give you about 5 seconds, or you can pause the video, and we'll go over why is A through D is right or wrong. So let's get started. Question number 1. Which of the following is true about an S4 sound? Hopefully you guys picked D. Preserve ejection fraction. If you did, great job. If not, we'll do a review at the end, okay? Question number 2. S3 sound is considered, okay, hopefully you guys said increase in preload, which is C. Great job. 3. A 10-year-old patient presents to the EM due to shortness of breath. Patient is a known athlete and has asthma. The ER doctor auscultated his heart and an S3 sound was noted. Which of the following is true regarding this patient? Okay, hopefully you guys pick C, normal heart. So now let's go over why 1 through 3 are the right answer. A through D is the right answer choices, okay? And we'll cross out. So let's get started. So question 1, which of the following is true about an S4? Let's go back to our mnemonic. S4. We flip it, parallel, and also what? Preserve ejection fraction. So that is why 1 is D. So reduce ejection fraction, what is that? That is S3. Can be normal, S3 as well. Normal in what? An athlete, pregnancy, and also what else? A child. Eccentric hypertrophy, also S3. Remember, we flip it, and that is what? An E. So we know that A through C, they're all in the same category, and trust me, on step, they will do that to you. So make sure you cross out what you know is incorrect. A, B, and C. So let's move on to question number 2. Question is, S3 sound is considered what? Increase in preload. And why is that? So remember, S3, eccentric, right, for our E, and it's added in what? Series, right? Let's add in our plus sign. C plus C plus C plus C plus C. And what are we doing to the left ventricle? We're dilating it. So more blood can what? More blood can fit in here compared to a normal box, okay? So compared to a normal box, say for instance, this is our normal box, right? This is our normal left ventricle. Now it's stretched out into our what? Our dilated cardiomyopathy. More blood can fit in here. Increase in afterload? No, there's no increase in afterload with an increase in preload. That's wrong. That would be seen in what? Right, an S4 sound, right? An increase in afterload was seen in an S4 sound. You know why? Because it's hypertrophy. Decrease in afterload? No, that's not correct. A decrease in preload, that is also incorrect. Why? Because it's not a decrease in preload. You'll have an increase in preload. Why? Because more blood can fit in the left ventricle. Question 3. I want to reread this question, okay? So a 10-year-old patient presents to the EM due to shortness of breath. Patient is a known athlete, okay? So let's highlight that. And has asthma. The ER doctor auscultated his heart and an S3 sound was noted. So they're telling us that there's an S3 sound in this patient, right? Which of the following is true regarding this patient? So we know that the answer is C, but let's understand why. Hopefully you guys thought about Holcomb, right? Holcomb. But I don't want you guys to think about Holcomb. Why? Because there is no, what? Family history. If in the stem it said that this patient, long uncle or cousin, had a similar attack and they died at a football game, then you should clue in what? Holcomb. This patient is a 10-year-old. He is a known athlete. This never happened to him before because it did not state that in the stem. So guys, there are certain things that I remember studying for STEP. I would just assume things. I would assume that the patient had Holcomb because this is the clinical vignette. It's telling me that the patient is a known athlete. He has shortness of breath. I would just think, okay, this patient has a family history of it. But if it does not say it in the stem, guys, cross it out. This is not right. Holcomb is not right because there is no family history. So eccentric hypertrophy. You would not see eccentric hypertrophy. There's no family history of eccentric hypertrophy. You wouldn't see this in this clinical vignette, and cross that out. Concentric hypertrophy. Again, that is incorrect. This patient is 10. It's telling that it's a known athlete, no family history. That is wrong. What about reduced ejection fraction? You would not see in a reduced ejection fraction in what? A patient who is 10, which is a young child, and also an athlete. You would not see a reduced ejection fraction. That is an S3 sound, right? So again, they put the same categories inside of the answer choices and make sure you understand why it's incorrect. So guys, let's go over this one more time. I just want to stress this and emphasize it so you guys can use your high yield mnemonics to get the questions right. Again, remember that S3, right, is high volume states, which is a volume overload, a dilated cardiomyopathy, and there's going to be an increase in preload. We add your C's so your C's gets longer, okay? S4, a high pressure state. Why is it a high pressure state? Because the left ventricle is getting constricted. So the black box here is normal and we're adding it in parallel. That is why the gray is making the left ventricle smaller. So that is why there's going to be an increase in afterload and also a high pressure state. Remember, for your S3 sounds, it can be physiological, pathologically normal in what? Pregnant woman, an athlete, and a young child. Always remember that. So guys, this is the end of my video. Hopefully the recall questions were helpful. Hopefully you got it right. If not, go back and learn the mnemonics and see you guys later. Remember, you're smarter than you think that you are. Make sure you go with your first choice and use your mnemonics. Bye, Med Squad.